Hi, my name's Sarah, and I am going to pass a urinary catheter on a male canine. I am going to use a cadaver for this task. So I've already gathered all of my supplies. I have some sterile gloves, an 8 French red rubber catheter, some sterile lube, my 2 vacutainers that have no additives, a Sharpie to label them with, a sterile needle to transfer the sample over into the vacutainer after we get it, and a sterile syringe. And I also have some chlorhexidine scrub. So my assistant is going to restrain our patient in lateral recumbency. And she's going to extrude the penis for me. So that I can scrub. So like I said, I'm going to use a chlorhexidine based scrub. It's going to work from the tip of the penis around down towards the base. Alright, and after he's been scrubbed, Miss Ashley is going to keep the penis extruded for me while I get all of my sterile items set up. So the first thing I'm going to do is set up my sterile gloves, which are going to act as my sterile platform to work off of. Okay. And then I'm going to open some sterile lube. And put it right here on the side so that I can lubricate my catheter. Next, I'm going to open my sterile syringe onto right here, right onto my platform right there. And then I'm going to, before I open my catheter or anything, I'm going to do a rough measurement of about how far I should be inserting my catheter. So the tip of the catheter is what's going to be placed in this part here. So I'm going to measure from about where the bladder should be. So on him, I should be inserting to about here. So I'm going to make a notch in my catheter so that I know exactly where I'm going to be addressing to. Okay, and then I'm going to open just this front part of my catheter. I'll open it right here so that we can see it. Taking care not to touch the catheter itself to anything, leaving it right there open where I can grab it without breaking sterility. There we go. So now I'm going to glove. As you can see, the catheter is right there, hanging out ready for me to grab. So I'm going to go ahead and glove, trying to make sure you can see everything. Okay, perfect. So I'm going to put on my right glove first. So I'm only going to touch this cuff part here. Slip my fingers right in, and then pull down on this part of the cuff. And then I'm going to slip this hand on the inner part of the cuff, slip my fingers on the inside, and around. So now I'm going to go ahead and take out my catheter, taking care not to touch it to anything else. And I'm going to lick the paper out of the way. And I'm going to lubricate the end of my catheter in my sterile loop. And then we're going to go ahead and advance through while Miss Ashley keeps the penis extruded. So I'm holding the catheter so that it won't touch anything but me. Pass it. And I'm passing it gently, taking care not to apply any excessive force. It's passing really nicely. Okay, and I'm about almost where my notch is, right there. So I'm going to pick up my sterile syringe, attach it to my catheter. Just a little bit so I can work with this a little bit easier. Go ahead and obtain a sample. Alright, and after I have obtained my sample, I'm going to gently pull out of the urethra. I'm going to detach my catheter from my syringe. And then I'm going to take off this glove so that I can open my needle, attach, and then put it right into our vacutainer. Letting it pull it in, and then once that one is full, I'm going to transfer over to our other vacutainer, so that we have plenty of sample to send off to the lab. So now, because this is not going to be run in-house right away, I'm going to label it with the patient's name, date, and that the sample was obtained via a urinary catheter. And then this sample will go right into the fridge to help keep it preserved for the lab. Now I'm going to take my sharps right out to our sharps container. And that's how you perform urinary catheterization on a male dog.